Selective internal radiation therapy with spheres microspheres. This patient was referred to the clinic by his primary care physician. He was a 61-year-old male who came with the main complaints of right upper quadrant abdominal pain, abdominal distension, and progressive unexplained weight loss since 2 months. He has history of hypertension and congestive heart failure and is on treatment. He is a non-smoker and not a chronic alcoholic. Physical examination. The GI system revealed right upper quadrant tenderness and pain on palpation. The liver was enlarged. Generalized abdominal distension was present with no fluid thrill. Other systems such as the chest, respiratory, and the extremities were within normal limits. So diagnostic investigations were ordered for him, which included the liver function test and CT scan of the abdomen and pelvis. The lab findings showed elevated serum albumin and total bilirubin level, while the other parameters were within normal limits. However, CT scan finding was what helped in making a definitive diagnosis. The scan here shows a mass, a tumor, which was approximated to be 4 to 5 centimeters in diameter and was localized. To identify the type of nature of the tumor, whether it is benign or malignant, a liver biopsy was done, which confirmed that the tumor was malignant. As per the American Association of Gastroenterology Guideline 2014, hepatocellular cancer can be treated by hepatic resection, liver transplantation, radiofrequency ablation, and chemotherapy. Hence, for this patient, the lesser invasive treatment option of radiofrequency embolization was recommended. Selective internal radiation therapy SIRT for liver tumors was actually developed in Australia in the 1980s and was adopted in USA in 2002. SIRT is a targeted treatment for liver tumor which utilizes sphere microspheres, which are small resin beads which contain radioactive yttrium-90 Y90. This Y90 is injected into the main artery that supplies liver tumors. Radioactivity is delivered directly to the tumor cells in order to destroy them, while the remaining liver cells are unharmed. It can be used as primary target modality for liver carcinoma or in combination with other cancer therapies such as chemo or radiation therapy. Not all patients are suitable candidates for SIRT. The criteria for eligibility for this procedure include patients who are 18 years and older with histological confirmation of carcinoma, patients with normal or near normal renal, hepatic, and hematologic function, patients who are not pregnant or breastfeeding, patients with predicted life expectancy of more than 3 months, patients with normal pre-assessment hepatic angiogram, which rules out reflux of hepatic arterial blood to stomach, pancreas, or bowel, patients who agree to comply with treatment sessions and follow-up imaging. Now we go on to the procedure. SIRT is done by insertion of a percutaneous catheter, usually into the femoral artery near the groin. The catheter is advanced into the hepatic artery. The first step involves embolization of the collateral hepatic circulation so that there is minimal potential for the microspheres to travel outside the liver and affect the surrounding healthy organs. During this procedure, a small dose of test beads is administered to check the amount of blood flow from liver to the lungs. After successful angiogram test dose result, percutaneous catheter is again inserted into the hepatic artery via femoral approach and lodged there. SIR microspheres are administered through this catheter directly into the tumor, which causes it to shrink. This procedure ensures that the Y90 radiation has minimal effect on the surrounding healthy liver tissue. This is a diagram which provides a glimpse of the procedure. The intervention radiologist makes an incision at the groin, Under fluoroscopy guidance, he advances a percutaneous catheter into the femoral artery, which goes up into the hepatic artery. The catheter is lodged at the point of the main branch of blood supply to the tumor, where the Y90 resins are released directly into the blood supply that targets the tumor and starts its radioactivity. The mechanism of action of SIRT is based on the principle that normal liver tissue receives about 90% of blood supply from portal vein, while liver tumor receives most of its blood supply from the hepatic artery. So the spheres, microspheres, are targeted directly at the tumor via the hepatic artery. The Y90 delivers beta radiation, which has a half-life of approximately 2.5 days. Therefore, most of the radiation is delivered to the tumor in the first 2 weeks of treatment. Hence, the large dose of radiation is implanted locally than is possible with the conventional external beam radiotherapy. Now let's take a look at the various benefits of the procedure. SIRT with spheres microspheres have proven to shrink patients' liver tumor more than chemotherapy alone. It has improved quality of life and increased life expectancy. In many cases, the shrunken tumor have been successfully removed by surgery at a later date. It has showed best results in patients who no longer respond to chemotherapy. Hair loss or alopecia have been rarely reported. The patient does not necessarily have to be admitted to a hospital for this procedure. It can be done at a well-equipped interventional radiology office as an outpatient. Medicare and most insurance companies in general cover the cost for this procedure and reimburse the facility for the full cost of outpatient treatment. Side effects and complications include abdominal pain, nausea, fever, fatigue, chills, loss of appetite. In rare instances, there is possibility that small number of microspheres may reach neighboring body organs such as gallbladder, stomach or pancreas and cause inflammation of these organs like cholecystitis, gastritis or pancreatitis. Proper post-procedural care and follow-up instruction should be given to the patient. In the first 24 hours after SIRT, the patient should wash hands thoroughly after using a toilet. Cleaning up any spills of body fluids such as blood, urine or stools is important. Patients should be instructed to avoid pregnancy or breastfeeding for at least 3 months after full course of the treatment. Routine imaging studies, radiographic scans and blood tests are needed to be done at frequent intervals to monitor progress. For this patient, 2-week follow-up CT scan was done which showed a reduction in the size of the tumor to 3.8 centimeters and the patient did not have any major complaints. Hence, SIRT has contributed in decreasing the mortality and morbidity associated with malignant liver tumors and has been highly appreciated by many physicians and intervention radiologists.